Welcome to the Telos Care Podcast, where faith meets formation. Thanks for joining us today as we have conversations around biblical counseling and how to bring hope and healing to a hurting world.
I want to talk to you about dealing with depression. Depression is a real thing, and depression is on a spectrum. What do you mean by that? Clinically, when a psychiatrist or a psychologist talks about major depression, they're not just talking about a bad day or case of the blues or something not going right in your world. They're talking about a level of depression that you are utterly dysfunctional. You can't get out of bed. You can't deal with anything. You are shut down. As a matter of fact, depression is one of the leading causes of disability today. So one of the leading causes is not back pain. It's not, it's not some heart disease. Depression. Now, I said that depression is on a spectrum, right? So on the very far end over here, you've got major depression, which you can't even function. But on the other side of this spectrum, there is a low-grade depression, what used to be called dysthymia. And what that looks like is it's just a low-grade undertone of low energy. You can't see completely clearly because you're so burdened down with whatever you may be going through. It's there, it's present, and it's like a cloud, right? It's like this fog that you're in. Most of us have dealt with either this low-grade depression that just is kind of there, or we've gone through something situational in our life and it has crushed us. Or some of you have dealt with clinical levels of depression where it has wiped you out for a long time. You may be dealing with like a low-grade depression where we just are ignoring it, we're pushing it down, we get busy, we distract from it, but it's there. If you're dealing with that, nobody really sees that except you or the people that are very close to you. And so you show up every day and you go through your routines, but all the while there's this undertone and it hurts and it's despairing and it's real. Now, let me say this for the Bible scholars in the room. There is nothing sinful about a depressed mood. It is not a lack of faith. It is a reality. Have you ever read the book of Lamentations? Have you ever read the book of Job? Have you ever read many of the Psalms? And what you will find there is many of God's choicest servants dealt with deep, dark emotion. I mean, it screams on the pages of Scripture. Individuals and let me just give you a couple of verses just to kind of, Psalm 107, verse 14, he brought them out of darkness, the utter darkness, and broke away their chains. Have you ever felt that? It is dark, it is utter darkness. But here's the good news in this. God can bring you out of depression. So in the beginning of Job, you hear right, he loses everything earthly. And so Satan attacked Job with his family, his finances, his health, even his wife, a whole thing. But then the attack goes from the outside world to the inside world. And that's what we're talking about here. And so in that point, Job is saying, God, where are you? Why aren't you here? Why aren't you listening to me? And so Job had a psychic break. I'm telling you, he was in a dark, dark, dark place. And in this, I believe that you see the enemy attacking him emotionally, and where he begins to question why God, why God, why God? I mean, it was a real thing. And then God speaks to him, right? So one of my favorite parts of the book of Job is in chapter 38, where there's this whirlwind, there's a tornado, and the tornado is symbolic of chaos, destruction. And God speaks to Job out of the chaos. And what I've learned in my own life is that God will speak to me out of the chaos, out of the pain, or in the pain, in the distress. In 2 Corinthians 1 and verse 8, the Apostle Paul, he's saying, we were so utterly burdened beyond our strength that we despaired of life itself. So even the Apostle Paul, who wrote probably a third of your New Testament, said, I despaired, and the despair was so great, I didn't even think I was going to live. And maybe you've gone through something, or maybe you're going through something, and you don't even know how God is going to get you out of this, or you don't even know how you're going to live through this. So this is a real thing. And so one of my points here is that if you deal with depression, it's not because you have a weak faith, lack of faith. It's not because you're sinful or whatever. It is a real, genuine response to life, and it is an attack of the enemy in your mind and in the emotions. Let me give you one more thought from a biblical lens. In Romans chapter 8, because let me back up just for a second. Why do we have pain and disappointment in this world? Because we live in a fallen world. We're no longer in paradise. If you don't believe that, just take a walk out the street, right? We're no longer in paradise. We live in a fallen world. And so bad things happen to good people. Things that we can't understand or trouble us. And so in Romans chapter 8, even creation, the Bible says, groans within itself for redemption. And the response is that you and I, the believer, we groan within ourselves. And so there is trouble, there is difficulty, there is despair, there is pain in this life. And depression, many times, is just a natural response to what's happening around in the world that we're a part of. And it's a natural response to the pain and loss that we suffer as individuals. It's a real thing. Individuals in the Bible who had great faith dealt with depression. And then historically, great people, read biographies. Individuals not only of great faith, but of great accomplishment, dealt with constant, persistent moods of depression. Abraham Lincoln, if he were alive today, he would probably meet every criteria for major depressive disorder. I mean, he had dark despair. And so my point is that this is a reality. We deal with it, and I want to give you some tools, and I want to give you a little bit of education about depression rather than just blaming it on, it rained today or things aren't going my way. Our moods, for the most part, tend to be a cycle. And many times it can begin with something that's disappointing, hurtful, painful. We lose something that's dear to us in life. And then our thoughts go there, our emotions go there, our behavior goes there. It becomes cyclical, but there's other components to it as well. I mean, there's genetic components to depression. There's physiological components, the way our body chemistry is designed. And then there's the life stuff too, and there's mindset. It is a cycle, and it can be a downward spiral. The danger side is, ultimately suicide. That's where this goes. Here's a few quick facts on depression. You've got about 18 plus million people that deal with this. Depression is the leading cause of disability for individuals ages 15 to 44. It is the primary reason why someone dies of suicide. And suicide rates right now are 1 every 13 minutes. Over 41,000 people a year in the United States commit suicide. And if you compare that to homicide's like 16,000. Suicide, 41,000. So it's a real thing. So in that cycle, when I begin going down in that spiral thing, if I'm way over here into depression, suicide mentally becomes the answer. It's the only way out. And as they say, it's a permanent solution to a temporary problem. I mean, emotion is an unpredictable event in our life. You may deal with it differently than I do. For example, depression is in men and women, it shows up very differently. So a man may not, cry. We may not, go into deep despair talking about how we feel, right? But what a man may look like dealing with depression, he's irritable, he's on edge, he's ready to fight, he's aggressive, he is given to substance use. And even in the suicide rates, it's very unique. In more women actually attempt suicide than men, but more men are successful at suicide. Why is that? Because men go to more aggressive modes of suicide. They use firearms or vehicles. But the rates of attempts are higher with women. Why is that? So many of them, they use pills or something like that. Someone finds them, they take them to the hospital, they pump their stomachs out, and then they get therapy, they get treatment. But depression shows up many times differently in men and women. And when it comes to suicide, and I think we should be aware of the reality of suicide, many men are successful with the attempt because we typically use a very aggressive form to take our lives. Let me talk a little bit chemically about this, because what we know is that individuals who deal with depression on a routine basis, outside of the difficulties of life, which is what we would call situational, they typically have reduced amounts of serotonin and increased amounts of cortisol in their body. Serotonin has a lot to do with mood stabilization. Cortisol is the stress hormone. So if you are dealing with stress, you've been dealing with stress for a long time, every time you get stressed or bring stress in your life, your cortisol rates go up. It's the stress hormone. I mean, when you're stressed, when you're angry, when you are set off, when you are triggered, you feel it in your body. And it affects your blood pressure. It affects everything, your heart rate. And in that state, if you go into fight or flight, you're thinking in a very reactional level. You're not reasoning, you're not processing, and your body is all jived up. You are just flooded with adrenaline and cortisol at that point. And typically individuals that struggle with depression have these reduced rates of serotonin. And that can be like a genetic predisposition. It's one of those things that you kind of come in life with. So why is this important? Because if you go to a doctor, like a psychiatrist, and they evaluate you and they say, well, you're dealing with symptoms of major depressive disorder, they're probably going to recommend a medical intervention or a medical treatment, psychotropic meds. What are those meds doing? Well, one, let me just say this. I'm not opposed to medical intervention. I think meds are not a life sentence. I think that they can adjust and get a person on track. And I think once that happens, then you do better with other types of therapy, like counseling, like structured activities, like this program, all types of things like that but those levels, those chemical imbalances, getting those chemical balances correct in your body is typically what a psychiatrist is trained to do and what they're trying to accomplish. The psychiatry, and I'd say this to take the mysticism out of psychiatry or the fear of the unknown of drugs. Outside of that, the psychiatrist is not trying to give you a chemical lobotomy. He's not taking a chunk of your brain out. They're trying to adjust these things. Now, I said it's not a life sentence. I know many people that had got a prescription, they got therapy, and the meds go away because the symptoms balance out and they get productive and they go on. I've had other people that I've worked with where they've needed medical support because of the chemical imbalances for many years in their life. If you have a heart issue, you're going to go see a doctor and he's probably going to give you a prescription. If you have diabetes, if you have a liver problem, if you have a whatever problem, you're probably going to see a medical doctor and he's probably going to give you a prescription. And so when it comes to clinical levels of depression or anxiety, I'm saying that there's value in that level of treatment too. Not that everybody needs meds. I'm just saying that if you're trying to get better and trying to get healthy, you may need medical support in the beginning of the process. Okay. Yes, sir. That's which comes first, the chicken or the egg, right? Great question. I can tell you this, that people that have a lot of insecurities, self-doubt, feelings of inadequacy, typically that has a lot to do with someone's mood. And so characteristics of a depressed person might be that they feel that way. Not to say that brought on the depression or not to say that the depression caused those feelings, but I can tell you that many times the way we think and the way we feel are very, very connected. If you continually isolate yourself, the depression only gets darker and your mindset continues to go downward in that spiral. Think about it. I mean, when the Lord Jesus came to this earth, he creates community, connection with his followers. The essence of the local New Testament church is a community of believers connected together, doing life together, bearing one another's burdens. In Acts, it talked about the first church having all things in common. They were living together. Yes, they were evangelizing and praising God and all of those things, but there was a human component. And my point is, you're so much healthier in community than being isolated. So every time you go into that fight or flight, every time you get triggered, cortisol, adrenaline surging in your body. And these are typically the outcomes of it. With serotonin, decreased levels of this mood stabilizing hormone affect men differently than women. But when it goes down low, typically that's when they identify that men have difficulty with concentration, ADHD, alcoholism, anger, sexual addiction, drug addictions. Women, it immediately manifests in anxiety, depression, emotional sensitivity, and many times they will binge eat and things like that. That's so many eating disorders are wrapped around that. And let me say this about psychiatry and meds. I've dealt with a lot of patients who are dealing with that treatment, and they come to me on the counseling or therapeutic side. But the psychiatrist, it's all trial and error. I mean, truly, they are practicing medicine. I mean, so they'll give it here, they'll tweak it, a little less of this, a little more of that. And for some folks, they get it right, and some folks, they never get it right. And let me say this, we've talked about depression being on the spectrum. You've got the major depression, and then you got the lower levels of low-grade depression, and then you got everything in the middle, right? What they say with the effectiveness of meds, it's most effective on the severe side. So someone dealing with major depression is going to have more of a benefit from a medication than someone dealing with a low-grade, mild, undertone, depressive state. So if you're not overwhelmed and made dysfunctional by your depression, the best treatment for you is lifestyle, exercise, being around people, renewing your mind, getting your mind positive, optimistic. Those are the best treatments for you. Most people on this low grade edge over here, they want a pill immediately. But pills aren't going to fix that. What fixes that are skills. And then over here on the extreme side, it's typically a pill and a skill. So if you're dealing with depression, whether it's in that category of major depression or that's this low-grade depression that you're just dealing with, there's help, there's hope, there's healing, but you've got to take a step in that direction, and you've got to be courageous to talk about it and to open up about it, to get the help that you want and the help that you need and deserve. So there's help, and I want to help you in that process. Don't think it's a life sentence, not for 1 minute, because I believe that our God is Jehovah Rapha. He is the God who heals. So with that being said, have a great day.
Thank you for listening to the Telos Care podcast. We hope today's conversation encouraged you to reach in and grow, and reach out to bring hope and healing to your community. Hit follow on social media to stay up to date, and hit subscribe to the podcast so you never miss an episode.